Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the opportunity to sit down with Colby Takeda, who is the co-founder of Pear Suite, an organization that is helping the community health worker workforce grow and develop throughout the country, and in particular here in California, where there is significant funding from Medi-Cal and Medi-Cal health plans that have partnered with Pear Suite to help grow the CHW or community health worker workforce. In today's episode, Colby shares a little bit about his journey into becoming a community health worker himself, which started often what I would say as a catalyst was his experience serving nursing home residents in high school. That's a really cool experience that he'll share today. And ultimately, this has led him to be a leader in the entrepreneurial space where groups like barber shops can now actually bill for some of their work as community health workers. We hope you enjoy today's episode with Colby. Feel free to check out other episodes of Pop Health Podcast by visiting us on our podcast channel on YouTube or anywhere you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Colby, thanks so much for joining the show today.
Good to be here. Thanks, Gavin.
No problem. It's a pleasure to have you folks. I was sharing with Colby off the recording that I just met him a few days ago. I had the opportunity to hear Colby share with a group up in the Sacramento area and the work that his organization is doing. And I was so impressed that I asked him, hey, could we do a podcast in like 2 days, basically 2 business days? And fortunately, Colby and I, we make our calendars work for this. So I thank you so much again, Colby, for the quick turnaround. Really appreciate it.
Absolutely.
So one of the things we like to do, Colby, with our guests, before we jump into what their organization does and your expertise, is we like to get to know you a little bit. I like to say humanize our guests. And so yourself, what's something about you that might surprise the audience? Maybe something outside of the workplace?
Yeah, absolutely. I born and raised in Hawaii. I think it's pretty unique to have so much. Obviously, there's a lot of connection between California and Hawaii and the rest of the world. And coming from somewhere that's so multicultural, I think being from the Asian Pacific Islander community, I think it's been really fascinating. There's so much excitement right now around diversity, equity, inclusion, and trying to build health equity programs that support different underserved communities. And I've really drawn upon my experience as a Japanese American living in Hawaii. So much of it is culture, it's family, it's relationships, it's how do we support traditions while also supporting our loved ones. That's how I kind of got first involved in the healthcare spaces. Care for my grandparents. Growing up, and you stay close to home, you stay close to your grandparents, and you support them. And as they age and get wiser and more supportive of you, you have to contribute to their lives and help take care of them. And so I really draw upon a lot of experience and love for my grandparents.
That's awesome. So were they living with you? Were they neighbors in the same community?
Yeah, very close to home. Literally the towns over from me. Both my grandparents, our parents were there, and were a big part of my growing up. So taking me to soccer practices, taking me home from school, tutoring me on the weekends, taking me to Japanese school. Were very definitely a big part of our lives, and I thank him for that.
Yeah, that is awesome that you had both sets of grandparents so close. Now, you mentioned Japanese school. So you speak Japanese? Are you fluent Japanese?
My grandparents, they've all passed now, but they probably, saddened the fact that I've lost all that Japanese, language that I've learned growing up. I've probably taken Japanese class level 1, 2, and 3 like 5 times over again. I had to keep going back down and try again. And I know just enough to order food in Japan, which is for me the important part, right? So able to order my favorite food, able to navigate to the restaurant and get to the bathroom. That's pretty much the extent of my Japanese knowledge.
Hey man, that's the most important stuff. I don't know about you, but around my social circles and my network, a lot of people want to go. Like there's something it's like a hot spot right now. Like people love going over there. Have you been over there anytime in the last few years or?
Yeah, absolutely. And my background is actually in aging, and there's such an excitement around the aging population, and thriving around purpose and helping Japanese live longer, and they do live longer. But how do we support that with different practices around gardening, around social isolation, loneliness, around support in the community? And Japan is quite excited right now.
That's cool. All right. So tell us. So you mentioned you grew up in Hawaii. You're obviously a close knit family. Tell us about your inspirations as you ultimately went into college, and kind of what drove you to older adults, to healthcare, all of that.
Yeah, I kind of stumbled into it. So my first little volunteer gig in high school, because they told you have to get some volunteer hours to get into college, was working in a senior home. I worked at a nursing home every Sunday. I would go to Kuakini Medical Center. I would be part of the therapeutic recreation team that would push the residents up and down the elevators. I would bring them to cooking class and bingo class. I would visit them in their rooms if they couldn't leave their rooms. This is my family growing up. They taught me how to play Scrabble. They shared with me their experiences. A lot of older adults there didn't have family that even lived in Hawaii. They taught me how to cook fried rice, because that was my job, is to lead the fried rice demo on Sunday.
Yeah.
Play games like Baccarat and Bingo, and it was just a wonderful experience to see them week over week and be able to build those relationships. It really brought a lot of empathy in my life. As a high school student, you don't learn a lot about how to care for others and do so outside your family, and so this volunteer experience, which I've done every Sunday, was just wonderful. That led to me going to public health, and it enjoyed the idea that you can help lots of people by creating programs and solutions that really impacts groups of people that oftentimes aren't getting attention and support.
That's great, man. I remember my first time walking into a nursing home. I was in my early 20s, and I was not expecting some of the challenges that residents have to deal with in nursing homes, and the fact that your parents you had an inspiration at a young age to do that on those Sundays. That's pretty neat. And I think in our society today, that's not the norm, but it's something I hope my kids, and I'm encouraging them to do as well. So it's really cool to hear that. So you then shifted your view into public health. Where'd you end up going to school?
Yeah, I went to undergrad at Willamette University in Oregon, small liberal arts university. They didn't even have a public health program, which is, this is pre-pandemic. And so lots of schools were just taking their typical degrees and apply. And you can go to pre-med, you can go to, PT and OT and different therapy. You can go do athletic training, but we had exercise science. And what's awesome is this department actually grew out, and then since then has launched a public health program. And there were so many graduates in my cohort or my generation that actually went into public health. Started off in exercise science, ended up working for health departments, ended up going to research, ended up going to different nonprofit work. So it's great that since then they've launched a public health program. I actually joined the board of trustees after graduating, and was there when they launched this. So it was great to be part of the students who represented this industry, this exciting trend of people that want to get more involved in policy around public health and around making a difference in populations. And now there's a whole department supporting it. So that was in Oregon, Pacific Northwest. So.
That's cool. I'm sure your family was, even though you were many thousand miles away, at least you're closer to them on the West Coast. So you finished school.
That's the idea, yep.
So you finished school, and then what happens? Or after undergrad, I guess.
Yeah, when finished school, had a great internship with a nonprofit. I think, nonprofits are a great place to learn about, how to get into the workforce, how to do all the things that are important for organizations that you might not get if you work for a big company. So I worked for a nonprofit working on health prevention and promotion, trying to reduce youth methamphetamine use. So it was a nonprofit focused on drug prevention. I was doing everything there from, creating the marketing materials to going to outreach events, managing our youth council, creating activities in schools and trying to promote policy change. It was really great. It was a 3-person team, and I just turned out to be a wonderful experience to really understand, how to work with communities, how to build relationships, how to move the needle on different issues. And it when I think about my entire career going into policy and public health, like that was such a great foundation. Being able to be so close to the leadership, but also understand how nonprofits work, which is really relevant to what we're doing now at Pear Suite.
That's great. And was that work in Hawaii? Was it still in Oregon?
Yeah, in Hawaii. Yeah, it was,
okay.
Which is very unique because the different populations that live in Hawaii, right? A lot of Native Hawaiian Pacific Islanders have a very different, connection to things like drug use and this, the shame that you have in the Asian cultures around drug and healthcare really played a role in how we impacted and created programs to support this population.
That really well said there. Okay, so you do some work in back in Hawaii. I noticed as well in your background you did some grad school in Berkeley. Did you do that virtually, or did you go back to California? Or
yeah, this is pre-pandemic. We actually did a public health program at UC Berkeley, but it was meant for a hybrid setting. So it was on campus, online. So it was really great. I was able to keep doing my work. By this time, I was actually working in senior care. At age 24, I became an administrator of a senior care facility, assisted living, and was in charge of hiring all the staff, opening up this new building. Took in 150 residents, assisted living, independent living, and memory care, and had to build the organization from scratch, which was absolutely a thrill. I mean, being able to see a building that was a plot of dirt to a 6-story facility and have 90 staff, 150 residents, families of those residents coming in. It was just a thrill, and learned a lot about senior care. Learned a lot about the business of healthcare. I learned a lot about the social determinants of health because we weren't just providing healthcare; we're providing food and transportation and exercise classes and coordinating with legal departments and helping them navigate resources. It was quite a wild experience, I would say.
So at age 24, you were doing this. So how often did you get the, "Hey, where's your boss?" or "You're too young"? Did you get those comments a lot?
I got that a lot, and I got a lot of residents who wanted to find me a girlfriend. Their grandkids are like, "Meet my grandchild," meet my granddaughter. Yeah.
Well, that is pretty funny, man, and that's quite an honor if they're making that suggestion. So sounds like they appreciated your leadership. So you had all
one thing I definitely miss.
Go ahead. Sorry.
I was going to say, one thing I definitely miss is, just building, having the time to sit down with them and hear their stories one-on-one. It brought me back to like my time in high school when I was in that volunteer role, like just being able to sit with them and, hear their experiences and their travels and their past careers. It's just such a wonderful, for them too, being able to speak to someone and have someone listen to them. And this is, obviously a big pandemic around loneliness and social isolation. These residents have so much to give to us and the future generations. It was just a great time, and I do miss out quite a bit.
Yeah, that's great, man. That's a great perspective. So you're getting all this experience with a big influence from family and your time in Hawaii. When are you starting to think about becoming an entrepreneur and getting more involved with the community health worker world? What was that aha moment, if there was one?
Yeah, it was. So while I was in assisted living, there was actually a company that was trying to develop software and trying to support the senior care community. They were trying to build an activity directory and trying to support calendars and newsletters and digital signage. And it was all things that I was doing for our community by hand. I was, on Photoshop. I was on PowerPoint creating these, weekly and monthly calendars, creating daily activity schedules to then display for our residents to see. And they came in and said, "Hey, we want to do this as well. Can you help us?" And I would meet with them on a monthly basis. They would take my templates and try to replicate that. They were, learning from our experiences and what I created and actually, using that to, grow their business. And it was such an iterative process. I absolutely loved it. I was, I ended up being like, kind of like this, free resource for them because they got to test things on me. We as a company ended up being one of their first customers. They ended up going off and selling to hundreds of thousands of residents and supporting, communities across the country. They sold their company to another one, and it was just like, wow, what did I get out of this? All this wonderful experience, and why didn't I do that myself? And it was just this moment of, I want to do that too. I want to be that team that came in, tried to solve a problem, iterative, learn, grew from customers, and tested things out, and then actually scaled it. I thought I could do it myself, if not. So I wanted to go out and get involved in the entrepreneurial space. There was a University of Hawaii, that really helped to incubate ideas and programs. And I got involved in one and learned about the entrepreneurial journey, right? How do we take an idea, test it out, ask and do discovery? How do we test, simple solutions to learn, to grow? And then how do we then take it and form business out of it? And I had previously did my MBA as well. And it was like all these different classes that you think you would never use again, like finance and how to build business models and how to do marketing, that I was able to take in and test things, ideas out. And it happened to align really nicely with the challenges and the free time I had through the pandemic. And so being able to, take the surge of excitement around community health workers, the need for solutions to support older adults in their home and where they live, being able to help, this big global effort to get more people vaccinated, to help them with resources like food and housing, and be able to take a simple solution like reaching out, doing friendly phone calls, and what was really where we started. And so that's kind of the birth of Pear Suite, is taking lay workers, people that weren't necessarily clinical in nature, but had this lived experience, had the passion and interest in supporting older adults, and be able to reach out to them and check in, see how they're doing by phone, and then navigate them to different resources.
Very cool. So who was paying for this, right? So first of all, are you a sole entrepreneur? Do you have partners? What are you able to share there?
Yeah, absolutely. So we started off as just, this is like a volunteer on the side thing.
Okay.
It was really a testing out phase where I was, still out of my full-time job, but was doing this on the side with some volunteers. We ended up getting some funding from the state. I think this is also the time when state departments of health were recognizing the need for more community-based solutions, right? How do we, shift from traditional working through public health departments and health plans and providers, and go to more churches and community groups, and groups that are on the ground in the community that spoke different languages, who had different shared experiences, and really were working with the populations that were hard to reach. And so we jumped on and supported a couple different groups, first with the Filipino American population, different migrant communities, the Native Hawaiian Pacific Islanders, and help them set up their phone systems, help them set up a solution to do friendly phone calls. Ended up using basic tech that was already out there, Google Sheets, different phone systems, different applications like Jotform or different HelloSign, things like that, and realized that every other nonprofit out there was also doing the same thing. They were putting together these different applications, and it was not talking to each other, and they had to find really weird ways to work. And that's what led us to see, there's a better way to do this. There's a tech-enabled way to empower these individuals, whether they're a clinician or a social worker, a community health worker, or even a volunteer, and get better data that can then be acted on. And that's when we realized we needed to find a technical partner to bring in to support and build this. And so we found my co-founder, Nick Lockett, who ended up building the tech and was used to building software solutions, but also understood how to scale things across different underserved communities.
That's awesome. So you mentioned like some funding from the state. Was Hawaii the starting point?
Hawaii was definitely the starting point. There was a lot of excitement in Hawaii, but interesting, lots of ties to California. So that's how, the same, CDC regions, so we're able to build some partnerships in California and expand our scope quickly to California, and do quite a good work in California during the pandemic.
Awesome. And before we jump into kind of the core content of California today, Pear Suite, why the name Pear Suite? Can you spell it for our audience?
Yeah, Pear Suite is PEAR, like the fruit, and sweet. So it was interesting. We thought of ourselves as like pairing people up, pairing the generations, pairing individual that wanted to help and someone who needed assistance. And so we played off the word pair, and of course we couldn't get pair.com, and so we had to kind of expand. So we ended up using Pear Suite, but we realized that there's so many things that the organizations we work with needed help with. whether it's the software, it's the education, it's the ongoing support, it's our services directly from our staff. And so it really worked nicely where it's a suite of offerings that we can provide support for our partners. And because our partners are so diverse, whether it's health plan, a community-based organization, a association or a hub, or a foundation, a funder, as well as the individual workers, it really worked out really nicely.
That's great. And folks, so we have PEAR for Pear, and then Suite is SUITE.
Yes, correct.
Like, sweet like the taste. It's actually not. It's
yes.
I guess you mean like a suite of services, right?
Exactly.
Yeah, awesome. So I was sharing with Colby as well, folks, and you guys may know, for those of you that have listened to the show or watched the show over the years, we typically don't have like a product service organization on the show. We typically like to have health plans or unique provider types. And there's a reason for that, right? We want to keep it educational. Colby, what he's doing with the health plans here in California and through the CalAIM initiative is something that I haven't seen before by any other organization. And he's receiving significant backing and support from California health plans. So it's really unique. I want to jump into what you're doing now. You touched on it earlier. Some of your users, right, could be community health workers, volunteers. Maybe for as we drill into California, can you tell us what's happened with the phrase community health worker over the years? And before you answer, Colby, we did have an episode a couple of years ago when the community health worker benefit was created in 2022, when we had Lisa Narosky from DHCS, but it's been a couple of years. So again, could you in a brief summary share what's changed, what's happening with community health workers here in California?
Absolutely. So there's been a surge of excitement around the community health worker workforce. And when we say community health workers, we really mean community health workers, promotoras, health representatives, peer advocates, peer coaches. There's all these terms that really describes the same individual, this person with lived experience, which is on the ground in the communities they serve. They really have a deep understanding of the communities they're supporting, and have that connection and trust that oftentimes isn't seen in the healthcare system, right? That big barrier of to overcome with individuals that are hard to reach in remote or rural communities. This frontline worker was key during the pandemic, and we're the ones that were building these relationships and getting to those who weren't getting the right information around COVID-19 vaccination or preventative measures, or helping people get connected to resources. And so I think the combination of the pandemic and the need for better solutions that were culturally sensitive, person-centered, that were in language, on the ground, and using community health workers who are traditionally sometimes not in healthcare settings. So community-based organizations. And so you take this movement to better incorporate this workforce, but obviously there's all these challenges, right? This is a workforce that traditionally isn't part of the billing ecosystem. So they previously weren't submitting claims. They don't know how to necessarily work in electronic medical records or handle sensitive data around HIPAA because they're working in nonprofits or community-based groups, right? All these different challenges with working with this population is combined with this excitement and this need to better partner with this group. And that's why DHCS came up with the solution of saying, hey, we haven't been able to pay this workforce in the past. They aren't licensed, they aren't clinical in nature, there's no credentialing in place. How do we, create some pathway for them to get paid for their work, which then will allow community-based organizations to work with health plans and providers and be part of that healthcare team. And so all these different factors, kind of going on at the same time, led to this benefit being rolled out. Nationally, there's a big conversation around how do we want to roll out this workforce and empower them to be a part of the healthcare system, and what types of policies we have to create to make it easier for them to either be licensed or credentialed, or have some standardized training, or have some tools to communicate and share data back to health payers and providers. So that's really the impetus of this excitement. It's the need to better reach community-based organizations, the goals and the needs around social determinants of health that aren't handled by your doctor or by their nurse. It's handled by these community-based partners that are the ones on the ground supporting with food, housing, transportation, social isolation, loneliness, helping to address digital literacy, helping to support with job placement. This recognition that those key factors are so key to supporting the life and well-being of individuals, and the need to incorporate a new workforce has been exciting, and really the impetus of why Pear Suite started.
That's great. I think most you use the mention of the partners being many of them community-based organizations, or that's kind of your core partner or maybe user of Pear Suite as an example. So when I think of community-based organizations, I've been in the industry for a while. I know what that means. Maybe like a local Meals on Wheels organization. What are some other, like, for lay people, I guess, that are listening, or folks who don't know what that means, community-based organization? Can you give some examples that would ring a bell, or people be like, oh, that's what he means?
Absolutely. So community-based organizations are very diverse in their nature, right? Some of them are nonprofits, organized groups that have a 501c3 IRS designation. They might be working out of community centers, or maybe ethnic nonprofits that will do programming like health classes or Tai Chi, or having volunteers visit your home, like a Meals on Wheels program or home visitation program. A lot of these organizations are small in nature, have small teams and rely on grants. Community-based organizations can also be non-nonprofits. It could be small community coalitions, or it could be a volunteer group working out of a church.
Yeah.
We have community-based organizations like barbershops, who are obviously reaching certain populations in that setting. We have community-based organizations working out of schools. We have one high school group that is participating in this benefit because they are a community-based organization supporting family members and different community members around their high school. And so community-based organizations really is a catch-all for these frontline groups that aren't necessarily always small, but oftentimes quite small in nature, and maybe part of the healthcare ecosystem, but also be part of the culture ecosystem. Might be supporting around food, or around caregiving. Volunteer programs are a big part of it, and grant funding is a big part of it. And so you can see now the challenges of connecting these organizations to these new funding streams.
Yeah, and you mentioned the challenges, so that's why you guys obviously were brought in. So one of the examples I want to jump into here is, you mentioned the CBOs, or community-based organizations. They're so used to having to apply for grants all the time and constantly having to find sources of money to keep them afloat. And they might even have like a full-time grant writer, if they're lucky enough to be able to afford a full-time grant writer on staff. So this is an exciting opportunity, as you mentioned, to have a consistent, reliable, ongoing revenue stream to help reimburse them for the work that they do, but they're not used to dealing with health plans, right? And so jump in and share maybe maybe an example or a success story of how you've helped, whether it's an individual CHW or a community-based organization, how you've helped them connect with the health plans and make them be able to properly, submit information to receive those payments.
Yeah, absolutely. And so you think about a healthcare organization that has, fancy technology to track the data of the patient, right? They have the ability to submit claims and have a billing department. They have entire legal teams and administrative teams that can manage the contracting process. I mean, all these things that you think about, they're not typical in a nonprofit, like you mentioned, a community-based organization. And so you think about the requirements of having to, track the work you do, be able to document what kind of challenges a patient or a community member is facing, and then show that you're actually addressing that with some solutions, and then gather all the information you need to submit a claim that gets processed, just like a doctor would submit a claim. This is new territory for a lot of these community-based organizations. A lot of these community-based organizations, aren't familiar with working with health plans where contracting requires, intense cyber insurance. Has requirements around an NPI, which is a number that you give to providers that work in this space. I don't understand the requirements around care planning and getting recommendations or referrals from clinicians that would suggest that they need services or care. So all of these barriers that the state had created, certainly they have some reasons for it. They tried really, really hard to reduce the barriers for community-based organizations. But some of these are legal requirements, right? These are things that you have to do to ensure that quality of care is being provided, and there are certain checks and balances in place. And so in executing the all plan letter, the Department of Healthcare Services created an all plan letter that details out the requirements of this benefit. A lot of nonprofits just didn't know it one existed, but once they did read the all plan letter, they ran and with fear. The all plan letter has lots of details and requirements around how to execute this benefit, and this is foreign territory for many of them, which is why they needed support from groups like us to help them understand the benefit, help them understand who can take advantage of it, how they can take advantage of it, what does it entail, what requirements are there around documentation. How do you get paid? And then, of course, you throw in the mix the management of this benefit by the managed care organizations, the health plans. It really creates some new variables that really creates challenges.
And so that's where you guys come in, and voila. So you gave an example in Sacramento, and even today, the barber shop, right? So a barber shop, I think you mentioned, is now they have an NPI, a national provider identifier. And someone from the barbershop or people from the barbershop who maybe have already been doing some of this work can actually get reimbursed for it, right?
Yep. And share more about that. So the benefit right now covers 4 different categories.
Okay.
And they're pretty broad in that you can think about a lot of these community-based organizations that you probably can think of some in your own hometown that are doing this work, but are they doing some kind of screening or assessment? Are they understanding the needs and challenges of an individual? Are they providing health education? Are they giving information or resources that might help them improve their health and well-being? And again, these are around the social determinants of health. So it's food, it's housing, transportation, home care. Is it anything that really touches these social determinants or economic determinants of health that might impact health and well-being? Are they providing navigation support? Are they helping people fill out forms, helping them understand how to utilize these programs and services, helping them get transportation to these locations? This is all part of the navigation of the complicated healthcare system we live in. Or are they providing support and advocacy? And so these 4 broad categories, this barbershop that I mentioned, they actually offer free haircuts for Black men in South LA if they do a health screening with them. If they are willing to share information and complete a screening around whether it's colorectal cancer screening, just visiting your doctor. What they do is, building community and trust at the barbershop has been something that's very close to their culture, and being able to, use this venue as a safe space to have discussions around topics that sometimes aren't, really open to, and in a setting from a person that looks like them, who's from the same community, has led to higher engagement around things like screenings, health risk assessments, getting connected to your doctor or provider, getting vaccinations. And so that's what they're getting paid for, is being able to provide that screening support, the health education, the navigation, and that's all part of the all plan letter, this benefit.
That's really cool, man. And it's a great pathway for a lot of folks, but not a lot of folks have actually jumped into it quite yet. I know when I was listening to you share with the group up in Sacramento, it's an exciting opportunity. There is movement, but the health plans, would like to see more. And there's a great opportunity for our listeners who might be interested. And there's actually some pretty significant financial backing to help get this done, including backing from these state-sponsored health plans through you guys, which is one of the reasons why you're not just a vendor, right? You guys are a true partner in all of this. Why do you think there's been some slow movement, and how can you maybe inspire our audience or give some advice as to how to get involved?
Yeah, absolutely. I think the last report that came out from DHCS reported less than 7,000 Medi-Cal members. And of course, there's over 14 million of them across the state and rising. Less than 7,000 have actually received this benefit. And you think about that's really low. Health plans are being asked and encouraged to seek out partnerships, build connections with these community-based providers, and bring them into their network to provide services. Of course, for health plans who've never worked with community-based providers, this is a challenge. And at the same time, on the other end of the spectrum, community-based partners have never worked with health plans. I think there's a big disconnect around education and awareness about these programs, a slow ramp up in building this network and finding providers that can provide these services and are willing to in partnership with the health plan. And then, of course, that a lot of that is around, education, it's awareness of this benefit, it's operationalizing the different elements of this all plan letter. So much more has to be done for education, for getting these groups connected to trusted advisors, get technical assistance, get support with how to get your NPI, how to build partnerships, how to fill out the forms to be an in-network provider. And that's what Pear Suite's really doing is being an accessible source for groups to think through how their current existing organizations and their current programs can align well with the health plan letter. We're working with groups that do health screenings at libraries, small nonprofit build of mothers that want to connect to children and their families, going to different libraries, and for them to realize that they can get sustainable reoccurring revenue from doing work with Medi-Cal members, which is they're already doing, for them was mind-blowing. And so how do we just get the word out that this exists? How do we meet these communities where they're at? They're not going to fancy conferences in the healthcare space. They aren't going, talking and browsing the health plan websites to learn about this benefit. They're going at these coalition meetings. They're meeting up with community partners at health fairs. And so we're going out in the community. We're finding them, helping them get education around this benefit. We've gotten tremendous support from local organizations like the California Healthcare Foundation to do work like this, building these partnerships, building the trust, and speaking in their language. Given that I've worked in nonprofits and many of our team members have as well, we understand their struggles. We understand that they're oftentimes going from grant to grant, building programming out and looking for better sources of funding. We know that they rely heavily on volunteers, and staff are overworked doing multiple roles in the company, and we want to align this benefit with those challenges and the opportunity for them to scale their impact, and that's what they're most excited about.
That's great. You mentioned like these I don't know if it was collaborative meetings or community meetings you mentioned, and that's where I met you. And when you spoke, there was a buzz. We often have speakers and things like that, and there was more of a buzz after you had shared. And I think, there's a reason you were there, and obviously we're here today because of it. So again, folks, if you work for a CBO, a health plan, if you're working in healthcare, I encourage you guys get to know more about the community health worker benefit in California and how Pear Suite is backed formally by the health plans to help you guys get involved. There's also grant money. We haven't gotten into all the details today, won't have time, but some of the health plans are really helping throw out grants to help basically with startup funding or extension if you're expanding your services, whether you're not profit or for profit. There's opportunities, and Pear Suite's really serving as a great, I don't know if bridge is the right word, but catalyst.
Yeah, absolutely. Yeah, absolutely. We want to be your partners. We want to help you understand the benefit. We want to help you get started. We want to help people get their first claim submitted, not after 6 months of planning or 12 months of figuring this out. We get you up and running in 2 to 4 weeks. And so we want to be quick. We want to show you the impact. We want to show you that you can get paid. And we actually love taking experienced other organizations that we helped and have them be the liaison and then that messenger to show other groups that they've worked with that, look, I was scared as well. I didn't know what I was doing. Pear Suite helped me, and now I can do it, and I want to help you as well. And so we love have the torch to groups that can be trusted leaders in the community and be that liaison.
That's great. So if folks want to reach out to you guys, Colby, pearsuite.com, or what's the best way to get that info?
Yep, pearsuite.com. We have different calendar links. You can always book time with us. We're here to help and support. We've gotten some funding from HCI, which was really focused in the state of California on training and professional development. And so the Department of Healthcare Access Information, we are offering now free training across the state, and we're going to make this available even after the grant period is over. And so free trainings are available to help people understand this and other benefits, help upskill the workforce, help get people connected. Even if they aren't called community health workers now, we can help them become credentialed to provide these services. And definitely reach out to me anytime, Colby at pearsuite.com, or any of our colleagues. You can obviously reach us through our website or other sources, but we're pretty present in the community. We love being on the ground in different spaces where community groups meet. And so I'm sure we can connect offline and online as well.
That's great. And I want to give a quick story before we wrap up here. So I met Colby officially on Thursday in Sacramento at an event, but I saw his organization a couple days prior in Burbank, California, at the California Association of Health Plans seminar that they held in Burbank. And there's a lot of exhibitors there. I saw this company called Pear Suite, which I'd never heard of. I'm like, okay, cool. another startup trying to make it. We'll see what, And candidly, I Didn't think much of it because I was there for other purposes, but I did notice them. And on Thursday, after hearing Colby speak, so Pear Suite is not, I mean, I don't consider you guys a startup because you guys are active doing this in many other states. You're certified, I don't know if that's the right word, as a community health worker yourself, which you haven't mentioned yet.
Mm-hmm.
And I believe many states, or you're pending in Michigan too. Like, am I getting this right here?
Yeah. Every state, the program is run by the Medicaid program, and every state has a different way of doing it. So our company, no one really has experience to do this state by state growth. And me as a community health worker myself, I always start as myself. Can I get credentialed in the state? Can I get approved or licensed, or can I join the registry? And so I'm officially able to provide services in 7 states now, and I'm working on a couple more just to understand like what are the complicated challenges. Like there's some states where you have to get mandatory training. Other states, you have to go through an online application process and show your experience. And so I think it just helps me to understand the challenges out there. And that then gets turned into how do we then help the groups on the ground in these communities. But yeah, we're currently now in 24 states across the country providing services, and have team members in 17 of them.
Wow. So Pear Suite is not, I mean, I don't know if you guys consider yourselves a startup. It sounds like you're not. You're like a legit organization. And the way you shared with humility, Colby, and even today with humility as you're having success is really cool, man. And that was another inspiration for me to approach you and have you on the show today. So again, folks, if you want to get connected with Colby, again, his email address that he shared was COLBY at pear, like the fruit, PEAR, and then suite, not like it tastes sweet, but actually like a suite of services, SUITE.com. So again, that's PEARSUITE.com. Colby, again, thank you so much for turning around in like 2 business days, making yourself available early morning, even with a Wi-Fi that we were hoping would work. I think it did. So thank you again, Colby. Really appreciate you today.
No, thanks, Kevin, for the time, and thanks for sharing such an important resource for groups that previously weren't supported in a way that they are now. So happy to meet with anyone, and excited to see this movement, this workforce, be more empowered and upskilled and supported in this really important space.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.